Hi, my name is Kizzy. I'm the lead midwife for education at the University of Lincoln, and we have developed a Student Midwife Reflective Journal, and this is given to all students when they start the midwifery programme. When we look through the actual document, there's an introduction explaining to the students how to use the journal, and to ensure that it doesn't contain any identifiable information for women, to make sure it maintains confidentiality. The journal's not submitted as part of an academic process because the idea of this journal is really personal. And on the front, we've got this teaching aid that we use, which says ready, respectful, responsive and resilient. And the idea is that students who come on the programme, our philosophy is that students become ready to be accountable midwives, responsive to diverse need of women and families, and our ethos is to provide respectful care whilst equipping them to becoming resilient practitioners. The idea is that this kind of teaching aid wrapped around the world, because we're not training students to provide care in one area. What we're providing them to do is to be able to work anywhere in the world, but also provide a really great standard of care for all women throughout the world from different cultures. Throughout the journal there's several quotes. We've interspersed them throughout the journal, so it gives students that opportunity to read them as they're filling in the journal, to boost them when they maybe need a boost, but also to just really inspire them. And the quotes come from academics, they come from senior midwives who are in leadership positions, and they come from clinicians, and they come from women who have received care as well. So the idea is that the students document the date and the year, and they just fill in literally 5 or 6 lines about how they're feeling that day, and they complete it throughout the whole year. They then come on to year 2 and they complete a few more lines, and year 3 and they complete a few more lines. So the idea is that by the end of year 3, all of the pages are completed, but they can look back and go, okay, well, what was happening last year? How have I responded? Would I respond in the same way? What have I learned from those situations? One other thing that we're doing is when students come in from clinical practice, when they come back into theory weeks, we ask them to bring 2 or 3 extracts from the journal so that we can discuss it. They can discuss amongst their peers what they've experienced in clinical practice, how they're feeling, what they've learned from situations. And it's really important that this remains a personal journal, and that the students know that this isn't going to be collected at any point, because it keeps that authenticity of the journal. One thing I would like to say is that the idea behind this journal was actually generated from a service user. So the idea came about from a woman who had a baby in the local area, and she attended our strategic stakeholder days when we were developing the programme. So this idea has actually generated from a woman who has received care locally. Since publicising this journal, I've had people contact me from different universities throughout the country who want to adapt this as well. So it's really great that it's kind of going out to other universities, and they'll be using that for their programme as well.
Hi, my name's Tia. I'm a first year student midwife at the University of Lincoln. I'm really enjoying using my reflective journal. I absolutely love the quotes that go throughout it. I feel like they give me a boost and they will help me in the future.
Hi, my name's Neve. I'm a first year student midwife at the University of Lincoln, and I've started using my reflective journal from September. I'm a natural reflector anyway, so I really enjoy just putting my thoughts down on page and going back over what I've learned in my theory weeks, and really looking forward to doing it in practice as well, learning through my experiences and reflecting, but also remembering what I've done. So.
Hi, I'm Kaylee. I'm a first year student midwife at the University of Lincoln. I've been loving using my reflective journal so far. It's been nice to look back at how far I've come already, and I can't wait to use it in the future, especially looking back in years to come at how far I've progressed.